Well, hello, podcast listeners. It's lovely to be back here with you, Simon Matthews, with you. And today, I have the great thrill and privilege to be joined by Robyn Tiger, who's not only an MD, but she's also a diplomate of the American Board of Lifestyle Medicine. So she is a lifestyle medicine physician, but she's much more than that. She's someone who is an educator. She's a coach herself and a podcaster. She's an author. We'll get to that as well. And she's got some other specialties, which I hope to touch on as we're talking as well. Robyn, welcome. It's a thrill to have you here.
It's a thrill to be here, Simon, and to start this year off together in such a positive way. Amazing.
Yeah, yeah, wonderful. Just after the new year, as we record this. Robyn, I wonder whether we could start our conversation with a story from you, in fact. And I wonder whether you could share the story with us of how you saved your own life.
Hmm. Yeah. So, Simon, as they say, make your mess your message. And really,
Ah,
this it was messy, and this is my message, which ends in a lovely way, as I am here with you living my most fulfilled, most healthful, most joyful life. But several years ago, probably beginning, if I'm honest with myself, back in residency when I was studying to be diagnostic radiologist many years ago, I started to develop lots of symptoms that seemed really disconnected. And I sought out help from many different specialists in medicine based on the symptoms I was experiencing. And they included things like migraine headaches, and vertigo, tinnitus, which is that ringing in your ears. My whole body hurt. I just felt like I call it like the Tin Man from the Wizard of Oz, where you just felt like you couldn't move. I was really anxious. I wasn't sleeping. I had bleeding gums, which seemed completely unrelated to anything else. I couldn't digest my food. So anytime I ate, I would get abdominal distension and pain. My bowel habits were all over the place, constipation, diarrhea. I never knew what was up with that. And I had a really scary symptom of paresthesias, that's numbness and tingling, that would come intermittently in my hands and my feet and the left side of my back. And of course, my doctor brain was terrified about that symptom, thinking I must have some debilitating neurologic disease because what else could that be? Lots of imaging studies, all negative. Lots of laboratory tests, lots of blood tests, all negative. And as I mentioned, I started getting lots of medication from these different specialists who were treating my individual symptoms. So I had, as we say, a pill for an ill. And I ended up having a pile of pills that I was taking every single day, and I wasn't getting better. And beyond the physical symptoms, I started to develop some psychological symptoms. Emotional health was being taxed, and I started to have some dark thoughts like, I can't take another day like this. Like, I just don't want to even be here, which were terrifying. Terrifying in the fact that I'd already had three physician colleagues die from suicide. I actually had lost a parent from suicide. And I was afraid that I was heading down that path. And I was already pretty active in exercise. I was training for lots of races. I was eating what I thought was then a pretty healthy diet, pretty healthy eating pattern. And I'm thinking, what else is there, right? I've done everything in Western medicine that I could imagine. I'm a Western medicine trained physician, but there's got to be other stuff out there because I don't want to end up like my friends, my colleagues, my father, and I have to figure this out. And I remember very clearly looking into the eyes of my then young children and just wanting so much more for them and not wanting them to end up as I had ended up. I wanted to be happy again. I wanted to feel good. I wanted to be present in their lives. And so when I started to look outside the box of traditional Western medicine, I started hearing about initially things like yoga and meditation, which I did a lot of eye rolling, Simon, to be completely honest. Lots of eye rolling, and people that are listening or watching may also be doing some eye rolling. But I really was at the bottom. I said, I was scraping the bottom and I said, what else can I do? And it just so happened that there was a class being taught, like a 101 series being taught at a studio down the home from my house, about 5 minutes away from my home. And it was being taught by an anthropology professor from the local university. And so my kind of snobby, I'll admit it, left brain thought, oh, she must be credible and authentic. She's not some Molly Moonbeam weirdo person teaching this class where people are wearing spandex, listening to weird music, and doing weird things with their bodies. She's got to have some credibility to her. So I signed up for this class. And I remember that day so clearly. I can't tell you how many cases I read in radiology or how many biopsies I did that day. But I came home exhausted. I fed my kids, I bathed my kids, I hand them to my husband, and with one eye open, dragged myself to get to this class at like 7:30 at night, wondering the whole time why I was going. And at the end of that first session, I felt calm. My mind was clear. I wasn't tired. And I had so much focus. My body didn't hurt anymore. And I had no idea what happened. And so that was the entrance into my world of understanding that there was more that I hadn't learned in my traditional Western medicine education. And I dove into the literature and I dove into my books because we had books at that time. There really wasn't internet. This was a good amount of time ago. And I started to unpack what I was experiencing as I continued to take these classes and as my symptoms that I described to you started to all decrease and eventually resolve. And what I understood was that the diagnosis that nobody had made was that I was suffering from a whopping case of chronic stress.
Mm,
And
mm,
as I started to learn how to regulate my own nervous system and decrease the stress hormones, the catecholamines, the cortisol, and all the havoc it was causing on my body and in turn my mind, I started to feel better. And it was miraculous. So that was the transition into
wow.
me starting to understand what happened and
Mm.
how to fix it. Just the beginning.
So I feel calmer just listening to you tell that story, Robyn. And to be clear, there's one attendance at this class was sufficient for you to observe the beginning of a difference.
Yeah, I had an incredible shift
Mm,
just after one class. And it was just being led in tools to regulate my nervous system,
mm, mm.
and it wasn't something that I'd ever been taught or experienced before. And it was just the beginning to a whole new world.
Wonderful. And you didn't mention this specifically, but I'm assuming that the eye rolling symptom also stopped at that time.
Yes. So the eye rolling absolutely came to a halt as the curiosity grew tremendously. So I could figure out what exactly was going on, why I was feeling better, because of course I needed to bring it back to the science. My left brain wanted
Mm,
science.
mm,
So understanding the anatomy and the physiology behind what I was experiencing really took over. The eye rolling kind of went out the door and the curiosity started to bloom.
mm, mm. What did you what did you do with what began as this deeply personal experience to then be able to have an impact professionally?
So I'm an avid learner, always love learning. And so, what I wanted was to learn more about what I was experiencing. And so, initially, I went into a yoga teacher training, never thinking that I was going to teach another person anything. It was just to help satisfy my hunger for information. And it was there that I learned about the field of yoga therapy. And just so those who are listening, yoga teacher training is a 200-hour base level education, and yoga therapy is a 1,000-hour base level education over 3 years on top of the teacher training, which enables you to help individuals with specific symptoms, illnesses, and diseases in a different way. So it's like doctoring in a different way, which was very
Mm,
exciting for me. And so I went on to become a teacher and then a yoga therapist. And it was there that I started experiencing meditation, which again, I used to eye roll about a lot. Those people sitting in those uncomfortable positions, trying to keep their mind quiet, saying weird things with their hands. I mean, I had all these preconceived notions, but experiencing a specific type of meditation during my yoga therapy training was profoundly transformative. And Harvard professors were lecturing to us on the benefits of meditation and showing us functional MRI images so I could actually see tangible evidence of
Mm,
changing brain neuroplasticity. So that was the next thing. So I went on to become certified as a meditation teacher in this specific type called iRest, which we can get into. And so really kind of honed in on that body and the body-based tools to
mm,
bring ourselves to calm. And then there was the
mm,
mind. Simon's like, well, what about all those thoughts? And so, having incredible transformation through being coached through life coaching, I went on to study to become a life coach to add that mindset piece. And
mm,
along the way, in moving to Asheville, North Carolina, I met incredible healthcare professionals who were certified in something called lifestyle medicine, which I had never heard of. And when they met me, they said, oh, you need to know about this, and they need to know about you. So, of course, I went right at that time, we had a computer. I went right to the internet and looked it up. And to see that there was an organization that was really all about everything that I was learning and more was incredibly exciting to me.
mm, mm.
And so I was connected to the education staff. They welcomed me with open arms and asked me to join the faculty and be lead faculty and subject matter expert in stress management for the Foundations of Lifestyle Medicine Board Review and sit for the boards. And so that was my entrance into that lifestyle medicine piece.
Wonderful, wonderful. And if you were to, let's imagine that a 2025 version of you were to appear before us now with the characteristic eye rolling and doubt about the veracity of all of this. How would you succinctly now describe what you've been able to learn and internalize to someone who's uncertain?
Yeah, I would say that you have superpowers, innate superpowers, to feel better at any time that you want to. You just need to learn how. And it's not your fault because there might be a lot of people here saying, I should know all of this. I hear this all the time. I should know this already. I was just coaching a physician yesterday, and we were discussing about food and how food creates mood and the impact of nutrition on our emotional health beyond our physical health. And there's a lot of, I should know this already, and a lot of shame and blame and guilt. So I like to put that out there as well, that today's a new day
Mhm.
and you don't know what you don't know. And that's something that I talk about a lot. But having the innate ability to feel better in any moment is really powerful. And to learn behavior changes that, as a collective, can transform how you feel physically, emotionally, and psychologically is possible.
Mm, mm. I want to talk. You've introduced the idea of psychology there, and I know that you have some training in trauma informed work, and I want to come to that shortly. But just before we do, I wonder whether you could share some ideas about the self care formula that you use based on lifestyle medicine to support people to experience thriving health and well-being.
Yeah, so that self care formula is really the recipe. And we think of the recipe as being spokes on a wheel. And so we
Mm.
know in order for a wheel to work properly, all the spokes need to be working properly and be aligned, right?
You're using one of my favorite ever
Oh,
metaphors, Robyn.
really? Oh,
Yeah.
excellent. So your
I,
listeners are familiar with this.
I use this exact metaphor. All the spokes need to be the same length if the wheel's going to roll.
Perfect. Yeah.
Yeah.
And we need to have the spokes, right? So most people can only see what's tangible, which is the physical body, and they don't
Mhm.
understand that there are so many other layers to us, right? So we're physical, emotional, psychological, spiritual. There's so many different layers of our being, and there are many different behaviors that affect each and every one of our layers. And so we have the pillars of lifestyle medicine and some more. So I see stress management, stress relief really as the umbrella under which the other behaviors are determined, because stress is going to determine what you eat. Stress is going to determine how you move your body, if you're moving your body, if you're sleeping, how well, if not. It's going to determine how you're connecting with others, if so, if not, and with respect to yourself. It's going to determine the escapes you may be choosing, whether they be recreational drugs, whether they be overdoing something that otherwise seems okay. They're going to determine whether, starts to determine whether you are getting outside and spending time outside in nature and so on. And so seeing all of these spokes on the wheel, both as the different layers of you, as well as all of the behaviors that you do based on how you're feeling, and needing all of them to be aligned and, as you say, the same length for that wheel to roll smoothly. And so the self care formula is just that, it's knowing how to prevent and relieve your stress. It's knowing how to have a healthful, FULL, dietary
Hmm.
pattern. It's knowing how to have nourishing sleep. It's knowing the type and amount of exercise that is recommended. It's knowing how to really have those nurturing relationships, those connections. It's knowing how to avoid escapes. And it's knowing the importance and how important it is and how to get outside in nature and incorporate that into your life, because that is the seventh unofficial pillar of lifestyle
Absolutely.
medicine. As my
Yeah,
friend
yeah,
Dr. Melissa Sunderman, the Doctor Outdoors, talks about, right? So
yeah, yeah.
so those, that really is the self-care formula, and that is the recipe. And just like when we're cooking a recipe, particularly baking, we need all those ingredients to be just right. Otherwise, it doesn't come out right, right? Otherwise,
Mm,
that wheel
mm.
isn't going to be smooth.
Yeah,
It's not going to
yeah,
be working properly.
yeah. I love that. I love that recipe analogy you've used there too, Robin, because in order to bring a recipe to fruition, we also need to know um, what the ingredients are and how to make use of them. And that's really what the essence of a recipe is. A recipe is not just a list of ingredients. Um, the recipe is the set of instructions that helps us understand how to make use of that list of ingredients. And in a similar way, when we don't have language for something, it's essentially impossible for us to exert any influence on that because we, in a sense, don't even know that it's there. So I'm seeing in what you're doing here that a significant part of it is supporting people to firstly have the language to be able to describe those parts of themselves that are not necessarily visible, and then secondly, to be able to work with those in a particular way to produce a particular outcome.
Yeah, exactly. So you're alluding to a really important piece of education that I know as a coach, um, you are aware of, and that is that behavior change. Like, how do you create effective behavior change? And it's not just having the recipes, but it's teaching others the steps of those ingredients so that they can achieve the goals that they want to.
Mhm. Mhm. While we're hovering around this idea of behaviour change, I wonder whether you could tell us the story of how the trauma-informed lens became a part of what you do.
Yeah, so during my yoga therapy training, I started hearing about more and more different avenues of ways I could be effective in what I was learning and help other people. And certain populations were particularly important to me initially, besides working with my own colleagues. Populations that I had felt throughout my training, and I spent a lot of time as a medical student, as an intern in my training, working at the Veterans Hospital.
Mhm.
And I felt that, I would get called and they would say, you know, patient Mr. Jones in room 405 is acting out again. He needs more Haldol. They used to call it vitamin H, which basically was, as they call it, snowing or basically knocking out patients when they're acting out, which I never thought they were really acting out, And what I came to understand is they were just having experiences, post traumatic stress disorder experiences that were just coming up, which was basically a normal reaction to abnormal situations that they experienced. And so I always felt uncomfortable medicating at that point, and I knew somewhere, somehow, there had to be a different way to help. Same thing with people with cancer. I spent a lot of time diagnosing cancer as a radiologist, and patients would be so happy coming in saying, "You saved my life and give me gifts and all of this." And I just knew from that moment that that was the beginning of their psychological, physical, and emotional debilitation as they started to go through treatment. And I always wanted to help them more and didn't know how. These are two examples of populations, right? And so I learned that there was a trauma informed approach in yoga therapy, which meant that you were taught how to create a safe container, a container where people could actually feel safe using your language, using your movements, um, understanding how to set up a room, and so on, so that people could have the opportunity to feel safe. And I had never thought about that before. And so it was very interesting to me to go and learn how I could be even more effective in educating when I can create a space where people could feel safe. And so the trauma informed piece initially came through yoga therapy, and then the meditation that I became certified, which was initially created for military veterans for Walter Reed Army Hospital, was also trauma informed, making sure that you are using language, setting up a space, offering opportunities for movement and so on in a way that people could feel comfortable, at ease, and could heal. And that just continued into life coaching, where I became trauma informed in life coaching and additional training so that I could create a safe space, even in the virtual space, where people could share in a way that they felt comfortable and heard and be vulnerable and feel okay doing so. And so it was really important to me to have this additional training because the truth is, Simon, that whether you're a military veteran, someone going through something like cancer, someone who's, been in healthcare, or just an everyday human, you've had some sort of trauma in some way.
Mm,
And
mm,
being able to
mm,
hold a space where I just assume everyone's had trauma so that they could feel safe and heal is really, really important to me. And
mm,
that's why I pursue this education.
mm. So it's a wonderful perspective, and you and I share some I guess professional experiences in that I've also worked extensively with military veterans and first responders among some other groups as well. And uh, it's easy for us to think of trauma as belonging to those groups, military veterans, first responders, and certainly they uh, are much more likely to be exposed to things that we know are traumatic. But there are some current estimates that suggest that around 70% of the world's population has been exposed to something that we would consider a traumatic experience at some stage in their lifetime. So, in some ways, I think being trauma informed is also is almost not an option anymore. It's almost a necessary part of being able to respond empathetically, to respond compassionately, and to support the people that we work with to be able to uh, move into a life of thriving and health.
Yeah. And I found it to be really helpful, even in just everyday communication, everyday experiences, being aware of that and really, creating spaces for people that you meet every single day and giving them grace for whatever it is they may be going through.
Mm. Mm. Robyn, I'd love to focus a little bit more on stress, if we could, and in particular, I'd love to. I know you've written a thing or two about stress, so I'd love to hear about that. And in particular, I wonder if we could have a discussion in here about the difference between um, a stressor, um, which I think most of us will agree is not optional. Stressors exist all around us in the world. Some of them are internal, some of them are external. Differentiate between that and the experience or the feeling of stress.
Yeah. Yeah. So, first of all stress isn't bad. Okay. So, I get that question a lot. I need stress so I can get things done. It helps me, be creative and so on. And so, I just want to share, first of all, that stress in itself isn't all bad and that there are different kinds of stress. We have the EU stress, which is the good stress. That's the coming on this podcast stress. That's the falling in love stress, right? And then we have new stress, NEU stress, which is neutral stress. That's when you hear something's going on, maybe far away, it's not a great thing, but it doesn't affect your everyday living. And then we have distress. And distress is what we really are talking about when we're talking about this chronic stress being on board. And that's the stress that's dangerous. That's the stress that causes us to feel the symptoms, as you alluded to, the symptoms I was experiencing. And and actually is the direct cause of most, if not all, of the chronic diseases in the world: hypertension, diabetes type 2, heart attacks, strokes, cancer progression and growth associated with dementia, and so on. So the symptoms are the physical manifestation of the stress response. The stress response is the natural cascade of events that happen in your body when your brain is thinking there's an emergency situation, real or imaginary. So I say that because sometimes you're just having a thought, conscious or subconscious, that causes this cascade of events. And what this cascade of events is, the stress response is setting you up to take care of whatever that emergency is, even when it's not really there. So, whether you're running away from a wild animal or having to lift a heavy object up for someone that you care about or so on, your body is going to get ready for that thing, including turning off your immune system, turning off your GI tract. You don't need to be digesting your food or dealing with um, foreign bodies and bacteria and so on when in an emergency. It needs to really put all of its energy elsewhere. Your body tenses up. You may even kind of get into a stance where your shoulder and your neck are forward, your head's forward, your body is tense, ready to go. And these are just some examples of what your body's doing. And what's happening, creating those things, are stress hormones that are being released. So you have catecholamines, which are acute stress hormones, and then we've got cortisol, which is, I think of as the big bad wolf when that one's being released over time. So we want this to work when we need it. But the problem, Simon, is when we are having chronic stress on board, this ongoing stress where your body's being taxed all the time. Your heart rate and blood pressure are going up. Your muscles stay really tense. Your GI system isn't digesting your food. Your immune system is shot, so you're getting sicker than you should, and so on. And so those are the symptoms that are related to stress. And again, the other things that happen to me, right? The migraine headaches, the paresthesias, the reflux, and so on. And then we have the stressor. And the stressors come in many flavors. They come in many flavors. So a stressor is anything that is causing this cascade of events in your body, the stress response. The most common stressor is a psychological stressor. So the most common stressor is a thought, real or imaginary, conscious or subconscious. And that causes most of what's going on in our bodies, in our minds.
Mm. So, without putting too much of a downer on it, sometimes we can be our own worst enemies.
Yeah. Yeah. When people say it's all in your head, sometimes it is, right?
Uh-huh.
But it
Yeah.
doesn't mean we can't fix it. It's just a
Yeah. Yeah.
realization. It's very, very freeing when you start to recognize the power of your thoughts, real or imaginary, conscious or subconscious, and the effect that it has on your body
Mm.
and how you can actually turn that around.
Mm. Mm. What can you tell us about the the kind of the mapping, if you like, between the pillars of lifestyle medicine? Sorry, let me reframe that. The other pillars of lifestyle medicine: nutrition, exercise, social connection, sleep, and stress. I wonder if you can tell us about the interaction between those pillars.
Yeah, so there's this bidirectionality I like to think about. The stress is the umbrella, but there's this bidirectionality. There's this two-way conversation that's happening between stress and the other pillars. So when you're feeling stressed and you are craving certain foods, who here listening goes to the refrigerator and pulls out a piece of kale? Said no
Yeah,
one ever.
no
No
one
one,
stress eats
right?
kale dipped in hummus, do they? No.
Kale dipped in chocolate, maybe. Never had that. But the thing is, when your stress response is on board, your body is craving immediate energy. Okay? So your body wants sugars and fats and it starts mobilizing them from your body internally, but it's also craving them. And that's why when you are feeling stressed, you want chocolate, cakes, cupcakes, French fries. You want things that are full of sugar and fats, okay? Because that's what you crave when you're stressed, right? But the bidirectionality is that when you eat foods that have added sugar and saturated fats and lots of chemicals and all those things that you can't pronounce, right? It actually causes you to feel more stressed and more anxious. So the bidirectionality there is the food creating mood, like we talked about a little bit earlier, right? Now, when you're feeling calm and you're eating kale and you're eating lots of veggies and fruits in their whole forms, um, those fruits and veggies and legumes and nuts and seeds and beans and that actually allows you to feel calmer, more grounded, less stressed. And it's just this incredible bidirectionality that happens between stress
Mm.
and the foods that we eat.
Mhm.
Now, when you're feeling stressed, who here sleeps well? Said no one, right? No, we don't sleep well. It's hard to fall asleep. It's hard to stay asleep. You wake up tired, counting the minutes until you can go back to sleep. And when you don't sleep well, you feel anxious and stressed, and that makes it harder to sleep. So there's the bidirectionality there. When you're feeling stressed, you are more likely to not exercise at all or to exercise too much. And actually, guilty here, that was something that I used to do is over exercise and I was in pain all the time, right? And when we don't exercise or we exercise too much, that's actually causing us to feel more stressed. When
Mhm.
we're feeling
Mhm.
stressed, we are not connecting with other people. I mean, who here is a nice person to be around when you're feeling stressed? Who here knows what it's like to say something you wish you could take back? Do something you wish you could take back. So you're either someone that's sort of being reactive and acting in a way that's like upsetting others, right? Or you're someone that's becoming isolated and you're staying away from others, right? And so either way, you're not connecting with other people. And when we don't connect with others, when we don't have that nourishing connection, we feel more stressed and anxious and depressed. When we're feeling stressed, we're more likely to reach for external substances and other escapes so that we can feel better. We want a buffer. We don't want those emotions and feelings that are so icky to be present, right? So we may take recreational drugs. You may overeat or eat more foods that aren't healthful, right? You may do other things. I have clients that read trashy novels till 3 in the morning. I have clients that over garden, clients that over crochet, right? So even things that seem healthy can be done too much. And when you're feeling stressed, you're not getting outside and connecting with nature, right? And we know that when we're not getting outside, nature is medicine, that it decreases our stress hormones just being outside, decreases depression, and we're cooped up all the time that makes us more stressed and anxious. So there's this bidirectionality happening between stress and the other pillars of lifestyle medicine.
Mm. And as you talk about it, Robyn, it sounds almost like a multi-directionality as well.
Mm,
There's a very important, I think, set of systemic relationships, aren't there, uh, between what we call the pillars of lifestyle medicine. Um, but in fact, um, perhaps pillars is not such a great visual metaphor here because pillars are in isolation and
right.
they stand apart from each other. Whereas the idea that you're talking about here is an idea in which, well, spokes on a bicycle wheel, pieces of a pie, all of these things, have some common touch points where they're able to exert influence on each other.
Yeah, I mean, if you and I got a big poster board and put all these pillars down, and we can probably draw arrows between everything, as everything is talking to the next thing, right? And so they're all really affecting each other.
Yeah, yeah, absolutely. Robyn, if someone were to pick up a copy of your book, tell us first of all, what's the title that they should look for, and without giving too much away, what's something they might be pleasantly surprised to find within the covers?
Yes, the book is called Feeling Stressed is Optional, right here. And that's because, as you mentioned earlier, Simon, there are stressors and we can't prevent them from happening, internal or external, but we can change how we feel about them. And so feeling stressed is optional. And I started writing this book initially. The idea came in 2020 when the pandemic hit, and I knew that healthcare professionals were already high in percentage of anxiety, stress, depression, burnout, even suicide. And so I wanted to find another way to educate. I already had digital online programs and a podcast, and now teaching in person. Although that got that got cut when the pandemic hit, and so there was the virtual space. And then how else can I be helpful? And so really, that's where the idea for the book came from. And so I wanted to write it in a way that really helped healthcare professionals, but I also recognize that stress is a universal problem. And so I wanted to write in a way that everybody could understand. So you may be pleasantly surprised to find that although its subtitle is Transforming the Life of the Chronically Stressed Physician, it's really written in a way that everyone can understand. So I have college students finding it helpful, as well as octogenarians that are, reading it and
Mhm.
giving it out to their healthcare professionals as gifts. And the other thing you may be pleasantly surprised to learn is that it's not just words. And so I've recognized over this last decade plus in educating others that people learn in different ways. People are different types of learning have different impact on different people. And so
Mhm.
it's a multimodal book, which means that yes, there are words to read, but there are over 20 QR codes that go to short, like 5-minute videos, because I know how busy you are, to practice tools along with me. So if you're a visual learner or an auditory learner, this is something that's really helpful. If you're a tactile learner, there are downloadable worksheets. If you're someone that likes to write and journal. So I've really tried to include different ways that people like to learn. And if you're someone that likes to socialize, there's a book chapter specifically for book groups with already curated questions. So if you're someone that likes to learn in a group setting and have that social connection piece, there's that as well.
There is quite literally something for everyone.
Yeah, that was my
Yeah,
intention.
yeah,
Yeah.
wonderful, wonderful. Robyn, we began this conversation with the story of your residency and the experience you had during that residency, which set you off on this extraordinary odyssey that we've had a little insight into over the last while. I wonder if I could ask you to imagine for a moment that you had an opportunity to establish and open a medical school. And let's imagine that funds were no issue and location, resources no issue at all. But you could create a curriculum that um, addressed the importance of what it means to live well and how physicians can support people to do that. what would that curriculum look like?
Yeah, it's a dream. I even have goosebumps thinking about it as you were painting that picture, because to imagine a medical school where all of this information was intracurricular and required, where all of these pillars, all of these spokes on the wheel, all of these things were in place as part of required education so that each and every medical student would learn how to take care of themselves. And then actually, the ripple effect would be them being able to teach that to their patients and their family and their friends and so on is extraordinary. And I only know of one medical school right now that has a lot of this integrated into their programming. And we need all schools. And I would extend that to beyond medical school. I would extend that to healthcare professionals in general,
Hmm.
because I've been working with nurses and PAs and so on. And I find it
Dietitians, psychologists,
dietitian,
social
everybody.
workers, and so on. Yeah, yeah.
Yes, of course, I think every school, human school in general, even starting at the elementary level, this could be of help. But I believe that healthcare professionals in general do not know how to take care of themselves because they were never taught. And I get a lot of shoulding from everyone that I teach. I should know this already. I should be doing this already. And I really got to wipe the should off and invite them to wipe the should off and say, it's okay, right? You don't know what you don't know, like we talked about earlier. And to have this integrated into healthcare professional education really is imperative. And I would love to see that happen while I'm still here on this earth.
Wonderful. Wonderful. Robyn, what a delight. Thank you. It's been a pleasure to spend this time with you. Thank you for sharing your own story uh, as a part of that, and thank you also for elucidating the links between um, what it means to live healthily and healthfully, um, and the pillars of lifestyle medicine. The important contribution of good management of stress in our lives, and above all, thank you for making this an eye-rolling free zone. Um, I I wish you I wish you all the best for the year ahead, and look forward to hearing more about your great work. Thank you again, Robyn.
Thank you, Simon. It's been a pleasure and an honor.